Hello everyone, I'm Brian Robert H. De La Silva from BSN2 12A and a student nurse from Davao Doctors College. So today I'm going to perform the Leopold's maneuver return demonstration. So Leopold's maneuver is used to systematically palpate the gravid uterus. So it is an easy to perform non-invasive procedure which is done to determine the position, presentation, and engagement of the fetus inside the uterus. So this is preferably done after 24 weeks gestation when the fetal outline can be palpated already. So prior to the conduct of the procedure, I have prepared the necessary equipment needed to conserve time and energy. So this includes a pillow, a towel, and lastly a stethoscope. So I also have performed hand washing to deter the spread of microorganisms. So now I am going to introduce myself to the patient. So, and verify my patient's identity and explain the procedure to the patient, and also I'm going to ensure my patient's comfort and privacy as well. Good morning, ma'am. I'm Leopold H. De La Silva and I will be your student nurse for today. So, may I see your wristband, ma'am? Okay, thank you. So, kindly please state your complete name. And your birthday?
August 26, 2002.
Okay, thank you for that, ma'am. So, for today, we will be going to do the Leopold's maneuver. So, what I'm going to do is expose your abdominal area only. So, I'm going to palpate and feel for your baby and then try to determine your baby's position inside your uterus. Will that be fine, ma'am?
Yes.
Okay, so I'm going to close the door for you so that no one from outside will be able to disturb us while doing the procedure. So, ma'am, before we begin, I encourage you to void first so that later during the procedure, you won't feel uncomfortable. So, an empty bladder promotes the comfort and allows for more productive examination. So, on the other hand, a distended bladder may obscure fetal contour and may slightly deviate the uterus and can make it difficult to really determine the baby's position with accuracy. So, okay, ma'am, are you done voiding?
Yeah.
Okay, so are you feeling comfortable?
Yes.
Okay, now ma'am, I'm going to put a pillow under your head. So, please lay down here, ma'am. Okay, thank you for that, ma'am. And now, ma'am, I'm going to slightly flex your knees. Okay, so will that be alright, ma'am?
Yeah.
Then, ma'am, lastly, I'm going to need to turn your right side just a little bit so that I can place a towel beneath your hip. So, ma'am, I'm going to assist you, ma'am. Okay, so, okay, ma'am. So, how are you feeling, ma'am? Are you comfortable with the position?
Yes, I am.
Oh, okay. Okay, so now, I position the patient supine on the bed and also place one pillow underneath her head and also slightly flex her knees and place a towel beneath her hips. So these steps are done to facilitate a more accurate assessment and provide comfort for the client. So flex knees as well relieves the tension of the abdominal musculature, and placing a towel beneath the patient's hips will prevent the gravid uterus from compression, the gravid uterus from compressing the large blood vessels to the inferior vena cava and the aorta. So, when a pregnant woman is in a supine position, thus preventing a supine hypotensive syndrome. So, next step is we need to stand on the patient's right side, so if right-handed, and face the patient. So, this is done so that later in the third maneuver, it is easier to grasp the symphysis pubis. So, okay, ma'am. So now we'll begin. I'm going to expose your abdominal area. Is it okay with you?
Yeah, it's okay.
Okay. So, okay, now I'm going to proceed with the first maneuver called the fundal grip. So to do this, I'm going to face my patient and then palpate for the uterine fundus to establish which part of the fetal pole is at the upper portion of the uterus. So, in the fundus, it could either be the head or the bridge, which is also called the buttocks. So, okay, so now, ma'am, I'm going to begin palpating. Is it okay?
Yes, it's okay.
So, now I'm going to proceed with the second maneuver called the umbilical grip. So, to do this, I'm going to palpate in a downward direction on both sides of the abdomen. So, applying a gentle but deep pressure. Okay, ma'am. So, I'll palpate again. I'll try to determine your baby's back extremities and interior shoulder. So, ma'am, I'm going to warm my hand first before touching. So, if the fetal back is palpated, then it would feel a long, continuous structure. However, if the fetal extremities is palpated, then it will feel nodular, reflecting the portions of the extremities. So, proceeding. Now, I'm going to proceed with the third maneuver called the Pollux grips. So, to do this, I am going to use my thumb and fingers of one hand, and then the lower abdomen is grasped just above the symphysis pubis. So, to determine if the presenting part is already engaged or not. So, ma'am, I'll palpate again. I'll try to determine your baby's back, extremities, and interior. So, if not engaged, a movable body part will be felt. So, now I'm going to proceed with the fourth maneuver. So, this is called the pelvic grip. So, this is done to determine the findings of the third maneuver and also determine the deflection of the vertex into the pelvis. So, to do this, I am going to face my patient's feet and then palpate for the metallic prominence. So, face the patient's feet and begin the palpation. So, now that I'm done with the fourth maneuver, I'm going to proceed to listening and counting for the fetal heartbeat. So, to do this, I have to locate the fetal back again and then place a stethoscope over it and listen for it for at least 1 full minute. So, okay, ma'am, I'm done with the maneuver. So, now what I'm going to do is to proceed to listening for your baby's heartbeat. Is that okay with you, ma'am? Okay, thank you for that, ma'am. So, we need to listen for it for 1 full minute. So, as is that I've done already a full minute. So, as I was listening to the fetal heart tone, I also noted its location, rate, and character. So, now I'm going to cover up my patient and make her comfortable. So, ma'am, I'm going to get this. Okay. Then, cover up the patient. So, how are you feeling, ma'am? Are you comfortable with the position?
Yeah, I'm good.
So, okay, since we're done, I have determined your baby is in a cephalic presentation. So, this means that your baby's head is in the lower portion of your uterus and your baby's buttocks is at the upper portion of your uterus. So, you should know that this position is the ideal for babies during delivery. So, while listening to your baby's heartbeat, I have also counted many times your baby's heartbeat is in 1 full minute. And I have found out that it is at least 125 beats per minute. So, this falls within the normal range. So, okay?
Okay.
So, that's it for today. Congratulations for your baby. Now I'm going to leave so that you can have some rest. So I'll be in the nurse station, so if you need anything, do not hesitate to use your call button so that I can come back here immediately and attend your needs. So after that, after doing the procedure, I'm now going to proceed with the aftercare of the equipment that I use, and also I'm going to document the findings of this procedure. So that's it. Thank you.